My name is Laureys. I'm a neurologist and I created the Coma Science Group at the University and University Hospital of Liège. Our area of expertise is really understanding brain plasticity after acquired brain injury, being traumatic, hemorrhage, ischemia, stroke. So it's using all those brain imaging techniques to help clinicians because we're still facing a major diagnostic, prognostic and therapeutic challenge when we talk about the brain, coma and those chronic disorders of consciousness. For us as Coma Science Group, it's a wonderful opportunity to work here with a Center of Excellence. TRAINM, I think, is internationally known for the state-of-the-art neuro rehab, and as we do, making use of the latest technologies. And I think that's terribly important. I think this collaboration is truly win-win. I think it's great for the people from my team. We're about 30 clinician scientists to have the opportunity to here work together and see how really these technologies have an impact, change lives. And of course, rehab is still multidisciplinary, so you need great people, and you do have great people here at TRAINM, but also offering top technology, robotics, virtual reality, but also in terms of brain stimulation, where I think we've been pioneering the field of non-invasive electrical brain stimulation. The challenges are twofold. So, of course, we want to make people with severe brain damage better. That's a huge challenge. That needs a whole team. And then there's the technologies. And within our team, the Coma Science Group, I think we've been, for the past 10 years, pioneering the field of non-invasive electrical stimulation. And having the opportunity to see patients, follow them up, is a wonderful example of a collaboration between industry, academics, really translating the current knowledge to improve quality of life after coma. As a neurologist, I have the opportunity since actually the opening of TRAINM to collaborate, to send patients here. So we, over the past 4 years, have witnessed that yes, it does make a difference. I have a couple of patients I really have witnessed the improvement, and it's always a challenge because these are not placebo-controlled studies. How can you ethically justify that? But to me it's fascinating to see how patients I've been following for years, and they're not getting better. There's this kind of leveling in terms of the recovery, and then they come to TRAINM. They're, I think, enjoying a new dynamics. I think the robotics, the wonderful team here, it has been shown in basically all the patients I send over. It has an impact, and that, of course, as a clinician, is very important. And it also permits us, with the Coma Science Group, to do clinical studies. I think, yes, we have the clinical challenge, but we also, as a research team, want to push the boundaries of our current scientific understanding. And so that's what this collaboration between TRAINM and the Coma Science Group is all about. It's translational neuroscience. It is doing the best possible clinics, but also doing research together. And I think we're very complementary, and I look forward for the coming 10 years of this wonderful collaboration. As Coma Science Group, over the past 20 years, we've pushed the boundaries, and I think we've really given people hope after coma, chronic disorders of consciousness. What it's all about is this terribly complex organ that is the human brain. And when you damage it, it can be very fragile. But on the other side, it also has this resistance, this capacity to heal, what we call neuroplasticity. And we've shown over the past years that neurotechnology can help us to better understand those billions of brain cells and how they can change in the process of recovery. The challenge for me is to translate that knowledge into real clinical practice. So our area of expertise as Coma Science Group is to do research, but I'm also a neurologist, a clinician. And so this is wonderful to see how together we can make use of technologies to help better understand the process of recovery and push it by all possible means with, again, technology, non-invasive electrical stimulation, brain-computer interfaces, as we see here. So that's, to me, the added value of TRAINM. It is always looking for the latest technological tools to help patients in increasing quality of life and recovery in neurorehab. I think Coma Science Group and TRAINM share the same philosophy, and that is looking for the latest technologies that help us in the rehabilitation process. We've been pioneers, and still are, in electrical stimulation of the brain, in mind reading, brain scanning by all possible means, including brain-computer interfaces. And I think now this collaboration between Coma Science Group and TRAINM is really a unique opportunity to take devices like this, state of the art, and offer it to patients, families, and we've seen together since the opening in 2017 that it does make a difference. The battle is worth fighting for. The feedback we have from the patients, from the families, really keeps us going.